Bismillahirrahmanirrahim. I am Dr. Alishba Rasool, and today I will be presenting tetanus under the supervision of Professor Dr. Saira Afzal. The learning outlines of today's presentations are introduction, epidemiological triad, chain of transmission, clinical stages, levels of prevention, and recent updates. At the end of this presentation, participants will be able to have a broad view about tetanus, including its epidemiological triad, chain of transmission, clinical stages, along with the levels of prevention, and recently introduced strategies or updates. Tetanus is a serious disease that can cause breathing problems, muscle spasms, and paralysis. Unlike other vaccine preventable diseases, tetanus does not spread from person to person. It enters the body through cuts or puncture wounds. An acute disease induced by the exotoxin of Clostridium tetani and clinically characterized by muscular rigidity, which persists throughout illness, punctuated by painful paroxysmal spasm of the voluntary muscles, especially the masseters, trismus or lockjaw, the facial muscles, rhizus sardonicus, the muscles of the back and neck, opisthotonus, and those of the lower limbs and abdomen. The mortality tends to be very high, varying from 40 to 80%. Problem statement: tetanus is now comparatively a rare disease in the developed countries. Neonatal tetanus is a killer disease second only to measles among the six target diseases of the EPI. Even with treatment, the case fatality rate can be as high as 80 to 90%. It tends to occur in areas with poor access to healthcare, hence, it often remains hidden within the community. During 2012, a total of 10,392 cases of tetanus and 4,650 cases of neonatal tetanus were reported to WHO worldwide. The epidemiological triad: the host factors are age, sex, genetic, profession, custom, habits, and behaviors. The environmental factors are physical, biological, and social, and the agent factors are the biological, nutrition, physical, chemical, and mechanical. Agent: Clostridium tetani is a gram-positive anaerobic spore-bearing organism. The spores are terminal and give the organism a drumstick appearance. The spores are highly resistant to a number of injurious agents, including boiling, phenol, cresol, and autoclaving for 15 minutes at 120 degrees Celsius. Reservoir of infection: the natural habitat of the organism is soil and dust. The bacilli are found in the intestine of many herbivorous animals, cattle, horses, goats, and sheep, and are excreted in their feces. The spores survive for years in the nature. The bacilli may be found frequently in the intestine of man without causing ill effects. The spores are blown about in dust and may occur in a wide variety of situations, including operation theaters. Exotoxin: tetanus specially produces soluble exotoxin. It has an astounding lethal toxicity exceeding only by botulinum toxin. The lethal dose for a 70 kg man is about 0.1 mg. The toxin acts on four areas of the nervous system: the motor end plates in the skeletal system, the spinal cord, the brain, and the sympathetic system. Its principal action is to block the inhibition of the spinal reflexes. Period of communicability: none, not transmitted from person to person. Host factors: Clostridium. Commonly, tetanus is a disease of the active age, 5 to 40 years. This period predisposes to all kinds of trauma, and therefore the risk of acquiring the disease is pretty high. Although a higher incidence is found in males, females are more exposed to the risk of tetanus, especially during delivery or abortion, leading to the puerperal tetanus. Males appear to be more sensitive to tetanus toxin than females. Agricultural workers are at special risk because of their contact with soil. Rural-urban differences: the incidence of tetanus is much lower in the urban than in the rural areas. No age is immune unless protected by previous immunization. The immunity resulting from the two injections of tetanus toxide is highly effective and lasts for several years. Immunity lasting for a few weeks, less than 6 months, can be transferred to the baby if the mother is immunized during the pregnancy or if she already has a high level of immunity at the time she becomes pregnant. Tetanus is one disease in which herd immunity does not protect the individual. Environmental and social factors. Tetanus is a positive environmental hazard. Its occurrence depends upon man's physical and ecological surroundings. The environmental factors are compounded by social factors such as unhygienic customs and habits, application of dust or animal dung to wounds, unhygienic delivery practices, using unsterilized instruments for cutting the umbilical cord, ignorance of the infection, and lack of primary healthcare services. The mode of transmission infection is acquired by contamination of wounds with tetanus spores. The range of injuries and accidents which may lead to tetanus comprise a trivial pinprick, skin abrasion, puncture wounds, burns, human bites, animal bites, and stings. Unsterile surgery, intrauterine death, bowel surgery, dental extractions, injections, unsterile division of the umbilical cord, compound fractures, otitis media, chronic skin ulcers, eye infections, and gangrenous limbs. Incubation period is usually 6 to 10 days. However, it may be as short as 1 day or as long as several months. Long incubation is probably explained by the spores lying dormant in the wounds. Incubation is also prolonged by prophylaxis. Pathophysiology. Tetanus is an infectious disease caused by Clostridium tetani bacteria. The active anaerobic bacteria lead to the production of a tetanus toxin which enters the nervous system via the lower motor neurons and travel up to the spinal cord and brainstem. The spores become active bacteria that spread in the body and make a poison called tetanus toxin, also known as tetanospasmin. This poison blocks the nerve signals from your spinal cord to your muscles, causing severe muscle spasms. The spasms can be so powerful that they tear the muscles or cause fractures of the spine. Clinical features. On average, it takes between 7 to 10 days after infection for symptoms of tetanus to develop. Those symptoms can appear anywhere between 4 to 21 days after you've been infected. The first symptoms of tetanus are usually stiffness and mild spasms in the jaw muscle, jaw cramping, suddenly involuntary muscle tightening, often in the stomach, painful muscle stiffness all over the body, trouble swallowing, jerking or staring, headache, fever and sweating, changes in the blood pressure, and fast heart rate. Profuse sweating, exaggerated reflexes, chills, restlessness, fever, jaw stiffness, facial muscle spasms, tonic spasm, irritability, sore throat, difficult swallowing, headache, intact sensorium. Types of tetanus, trauma. Traumatic tetanus is a major and important cause of tetanus. Sometimes tetanus may result from most trivial or even unnoticed wounds. Perpudal tetanus follows abortion more frequently than a normal labor. A post-abortal uterus is a favorable site for the germination of the tetanus spores. Autogenic ear may be a rare portal of entry. Foreign bodies such as infected pencils, matches, and beads may introduce the infection. Autogenic tetanus is a pediatric problem, but cases may occur in adults also. Idiopathic. In these cases, there is no definite history of sustaining an injury. Some consider it to be the result of the microscopic trauma. Neonatal tetanus. Tetanus neonatum is generalized tetanus that results from the infection of a neonate. It primarily occurs in the underdeveloped countries and accounts for as many as one half of all the neonatal deaths. The first sign of tetanus in a neonate is usually an inability to suck or breastfeed and excessive crying. Characteristic features of tetanus are trismus, lockjaw, inability to open the mouth, risus sardonicus, forced grin and raised eyebrows, and opisthotonus, backward arching of the spine. No specific laboratory tests exist for determining the diagnosis of tetanus. The diagnosis is clinically based, however. The pro-tetanus test kits that can be used to determine whether an individual patient has a sufficient level of immunity to be protected against tetanus. It is used in Europe under the name tetanus quick stick that has been validated against ELISA measurement of serum tetanus antitoxin level. TQS take 10 minutes to read and are 100% specific for tetanus antibodies. If the test is positive, you can assume the patient has protection against tetanus for at least 5 years. Sensitivity is 55% for titers of 0.01 IU per ml, but 100% if titers are greater than zero point 0.5 IU per ml, which is 5 times greater than the accepted protective limit of zero point 0.1 IU per ml. Levels of prevention: primordial, primary, secondary, and tertiary prevention. Health promotion: tetanus germs can enter the skin through something as small as a pinprick, but they prefer deep wounds. Clean any wound you get with soap and water, then use an antiseptic. If the wound is deep or dirty, have your doctor check it out. If you haven't had a tetanus booster in more than 5 years, you may need to get another booster. Be sure to give your vaccine record to your healthcare provider. Specific protection: tetanus is best prevented by active immunization with tetanus toxide. It stimulates the production of the protective antitoxin. The aim should be to vaccinate the entire community and ensure a protective level of antitoxin approximately 0.01 IU per ml serum throughout the life. All persons should be immunized regardless of age. Tetanus vaccine schedule in Pakistan. The vaccine is administered to infants in 5 doses at 2, 4, 6, and 18 months of age, and then again when the child is 4 to 6 years old, followed by a booster dose every 10 years. It is recommended that pregnant women receive the tetanus toxide between 27 and 36 weeks of pregnancy. Vaccination schedule for women in pregnancy: first dose during the first pregnancy, then the second dose 1 month after the first dose, 6 months after the second dose, then fourth dose after 1 year, third dose, and 1 year after the fourth dose, fifth dose will be given. People of all ages need tetanus vaccine. Two preparations are available for active immunization: combined vaccine, DPT, monovalent vaccines, plain or fluid formal toxide, tetanus vaccine, adsorbed PTAP, APT. The primary course of immunization consists of 3 doses of DPT at intervals of 4 to 8 weeks, starting at 6 weeks of age, followed by a booster at 18 months of age, and a second booster at 5 to 6 years of age, and a third booster after 10 years of age. Monovalent vaccine. A primary course of immunization consists of 2 doses of tetanus toxide adsorbed, each dose 0.5 ml injected into the arm, given at the intervals of 1 to 2 months. The longer the intervals between the 2 doses, the better is the immune response. The first booster dose should be given a year after the initial 2 doses. Purified tetanus toxide should be stored between 4 to 10 degrees Celsius. It must not be allowed to freeze at any time. Temporary protection against the tetanus can be provided by an injection of human tetanus hyperimmunoglobulin or ATS. Human tetanus hyperimmunoglobulin is the best prophylactic to use. The dose for all ages is 250 JU. It does not cause serum reactions. It gives a longer passive protection up to 30 days or more compared with 7 to 10 days for horse ATS. ETS: if human antitoxin is not available, equine antitoxin, anti-tetanus serum, or ATS should be used. The standard dose is 1500 IU injected subcutaneously after sensitivity testing. ATS gives passive protection for about 7 to 10 days. Being a foreign protein, ATS is rapidly excreted from the body, and there may be very little antibody at the end of 2 weeks. Active and passive immunization. Simultaneous active and passive immunization is widely carried out in non-immune person. The patient is giving 1500 units of ATS or 250 units of human immunoglobulin in one arm and 0.5 ml of the adsorbed tetanus toxide PTAP or APT in the other arm or the gluteal region. This should be followed 6 weeks later by another dose of 0.5 ml of tetanus toxide and a third dose 1 year later. Adults should get a diphtheria tetanus booster once every 10 years throughout their life. This is true even if you don't have a wound. Getting a diphtheria tetanus booster every 10 years applies if you have a minor clean wound. Antibiotics, a single intramuscular injection of 1.2 mega units of a long-acting benzathine penicillin will provide a sustained concentration of the drug for 3 to 4 weeks, which is sufficient to kill any vegetative forms of the tetanus bacilli that may emerge from the sporulating stage. Penicillin has no effect on the tetanus spores. Prevention of neonatal tetanus in unimmunized pregnant women. 2 doses of tetanus toxoid should be given. The first as early as possible during pregnancy, and the second at least a month later and at least 3 weeks before the delivery. Immunized pregnant women, a booster dose is considered sufficient. There is no need for a booster at every consecutive pregnancy because of the risk of the hyperimmunization and side effects. These are the recommendations for the prevention of tetanus in the wounded. All wounds should receive the surgical toilet. Secondary prevention. Tetanus has no definitive cure, but it can be treated with surgery to clean an infected wound. It's also treated with anti-tetanus and anti-spasm medicine and antibiotics. You may need to be on a breathing machine until you can breathe well as your own. Tetanus is treated in the ICU. Even with modern medical care, tetanus can be fatal. From 1 to 10 in 1 in 5 people with tetanus may die from it. Complications can include breathing problems, broken bones, blood clot, and pneumonia. For people who survive, recovery can take several months. Nerve damage may take even longer to heal, or it may be long term. Now it's time for the recent updates. Key facts: tetanus is acquired through infection of a cut or wound with spores of the bacterium. The majority of the reported tetanus cases are the birth associated among newborn babies and mothers who have not been sufficiently vaccinated with the tetanus toxoid conjugate vaccine. In 2018, about 25,000 newborns died from the neonatal tetanus, a 97% reduction since 1988, largely due to scaled up immunization with TTCV. In 2023, 84% of the infants worldwide were vaccinated with 3 doses of diphtheria, tetanus, pertussis containing vaccine. The global neonatal tetanus elimination goal was launched at the World Health Assembly in 1989 to reduce neonatal tetanus as a public health problem in all countries. The Maternal and Neonatal Tetanus Elimination Initiative was launched by the UNICEF, WHO, and the United Nations Population Funds in 1999, revitalizing the goal of MNTE as a public health problem. As of July 2023, there are 11 countries that have not achieved the MNTE. Once MNTE has been achieved, maintaining elimination will require continued strengthening of routine immunization activities for both pregnant women and children, maintaining and increasing access to clean deliveries, reliable neonatal tetanus surveillance, introduction and strengthening of the school-based immunization where feasible. To sustain MTE and protect all persons from tetanus, WHO recommends that 6 doses of tetanus-containing vaccines be given to all persons from childhood to adolescence. Maternal and neonatal tetanus elimination initiative aims to reduce the MNT cases to such low levels that the disease is no longer a major public health problem. Unlike polio and smallpox, tetanus cannot be eradicated because tetanus spores are present in the environment worldwide. But through immunization of children, mothers, and other women of reproductive age and promotion of more hygienic deliveries and cord care practices, MNT can be eliminated, defined as less than 1 case of neonatal tetanus per 1,000 live births in every district. Progress towards achieving and sustaining maternal and neonatal tetanus elimination worldwide. This report updates a previous report and describes progress towards MNTE during the 20,000 and 2022. By December 2022, 59% 47 of 59 priority countries were validated to have achieved the MNTE. In 2022, among the 50 countries that reported coverage with greater than 2 doses of TTCV among pregnant women, 16 reported coverage of greater than 80%. Reported neonatal tetanus cases worldwide decreased 89% from 17,000 in 2000 to 2,000 in 2021. Estimated neonatal tetanus deaths decreased for 84% from 46,898 to 7,790. However, the global disruption of the routine immunization caused by the COVID-19 pandemic impeded the MNTE progress. Since 2020, reported neonatal tetanus cases have increased in 18 priority countries. Integration of the MNTE strategies into priority countries' national post-pandemic immunization recovery activities is needed to achieve and sustain the global elimination. This is the estimated number of neonatal tetanus deaths and estimated percentage of infants protected at birth against tetanus worldwide 2000 to 2022. Number of women of reproductive age protected by tetanus toxoid containing vaccine received during the supplementary immunization activity. Now it's time for the MCQ session. A patient was admitted in the psychiatry ward. All of a sudden, started to behave abnormal and had contractions of his body. Doctor diagnosed him of having tetanus. Which among the following is not a common symptom of tetanus? A. Decreased heart rate. B. Sweating and fever. C. Difficulty swallowing. D. Muscle spasm. Or is it E. Fever?
A.
A.
It's A. A farmer ABC was working in a field barefoot. Suddenly, he got a minor injury on his left foot. There was a mild bleeding from the site of injury. Best step to be taken during this situation is immediately go to tertiary care, wash and take some rest, wash wound and go to nearby doctor. Ignore this little wound. E. Apply mud on the wound.
C.
E.
C is the right answer. Females are more exposed to the risk of tetanus, especially during delivery or abortion, leading to puerperal tetanus. When can a woman with tetanus pass this disease on to another person? A. After delivering the placenta. B. From an open wound. 3. While the scale is visible. D. When the fever is settled. E. When she is fully immune.
A.
It's B. The pro-tetanus test kit can be used to determine whether an individual patient has sufficient level of immunity to be protected against tetanus. That kit is said as TQS in most developed countries. Regarding tetanus quick sticks, A, it takes 1 hour to interpret. If the test is positive, the patient has contracted tetanus. They are 100% specific for tetanus antibodies. They are 80% sensitive for titers of 0.01 IU per ml. E, 100% sensitive if titers are less than 0.5 IU per ml. Does anyone like to answer this? It's C, they are 100% specific for tetanus antibodies. A person after falling from the tree got injury on big toe. He is at great risk of getting tetanus, an acute disease induced by the exotoxin of Clostridium tetani. Tetanus is best prevented by active immunization. This immunization drug belongs to which group? A. Live attenuated vaccine. B. Heat kill vaccine. C. Formalin kill vaccine. D. Toxoid vaccine. Or is it E. Messenger RNA?
D.
D.
Yes, D is the right answer. Tetanus is a very dangerous infection caused by Clostridium tetani. Very rarely a person can get exposed to that through an intact skin. Once exposed to the infection, a person can develop this disease in as little as dash days. A first, B 4, 6, C 6, D 8, or E 10.
E.
It's A. A child was born to an unimmunized woman, was having neonatal tetanus and died in a week. That woman was then immunized after that. Which among the individual is recommended for her subsequent pregnancy to be prevented from tetanus? A. 2-dose vaccine before delivery. B. Tetanus toxoid before the last 30 days of delivery. No vaccine is required at all. Booster should be given once. Vaccine just after the delivery.
A.
It's D. A neonate was brought to the pediatric emergency of Mayo Hospital having difficulty breathing and muscle spasm and needed mechanical ventilation support system. He was diagnosed as neonatal tetanus. The first sign of this disease is A. Forced grin, B. Raised eyebrows, C. Decreased cry because of tense muscle, D. Inability to suck the breast milk, E. Lockjaw.
D.
Yes, it's D. A cold chain is a low temperature controlled supply chain. An unbroken cold chain is an uninterrupted series of refrigerated production, storage, and distribution activities. For tetanus toxide, the appropriate temperature should be A 4 to 8 degrees C, B 4 to 8 degree F, 8 to 10 degrees C, D freezing is ideal. No cold chain is required. It's A. A single intramuscular injection of 1.2 mega units of a long-acting penicillin will provide a sustained concentration of the drug for 3 to 4 weeks and might help in relieving the symptoms of disease. Regarding this, A. Penicillin acts directly on the spores of Clostridium. B. Penicillin is given to reduce the superimposed bacterial infection. C. It acts on the vegetative form. D. It should be used hand in hand from the very beginning. E. It acts very fast to control the lockjaw. It's C. It acts on the vegetative form of Clostridium. This is the key of the MCQs. Thank you, everyone.
Thank you very much. A very nice presentation. Uh, Previously, we have a ward of tetanus at Mayo Hospital that is associated with all the cases that are referred from different areas of Punjab to Mayo Hospital. But with the passage of time, the tetanus cases has decreased drastically. We have seen over the years that the tetanus vaccination has been very effective, and many cases are not appearing with the complications of tetanus that are life threatening. Previously, it is very common to see a person, especially during the rainy season when there are lot of accidents like the falling of the roof and the falling of the walls in different areas because of the heavy rains. We used to see patients with locked jaws, opisthotonus, and they have a lot of muscle injuries with open wounds that are usually infected with the tetanus, Clostridium tetani, actually. So, with the passage of time, vaccine has been very effective. Initially, the vaccine that has been given was ATS, that is the anti-tetanus serum, and it has lot of allergic reactions. I would like Dr. Lishma, please also add a slide on the differences of ATS and the tetanus sera that are available today, along with the formalin killed vaccines as well as immunoglobulins, because we know in tetanus both active and passive immunization is required. So both active and passive immunization is given at the same time. We are not using animal as a developer of the sera as a models for further vaccine development, but we are using actually the human developed immunoglobulins and human developed seras through different technologies. So I would like you to please add one slide on the recent advances on tetanus in your presentation. Overall, it is a very good presentation, and there is a very important question that is raised again and again, that if someone is having a wound, should we give the tetanus vaccination, both passive and active? The answer is yes, because still it is widespread, and the tetanus spores may be present in the dust and soil where a person is having a wound, as it is anaerobic uh, bacteria. So or the spores, they can grow into bacteria in anaerobic environment. So the spores, if they are contaminating the wound, it may develop into a bacteria that can cause tetanus, and once the tetanus is developed, it is usually life threatening condition because of the lockjaw and opisthotonus and other spasm of the muscles. So the question must be answered like that: if someone is fully vaccinated and the 10-year gap has not been there, so there is no further need of vaccination. However, if the last vaccination is more than for 10 years, then the person must be vaccinated. The schedule consisted of actually three vaccines. One vaccine is given to the child, the second is after 4 weeks, and the third is given after 1 year or usually at 5 years of age. So after the complete vaccination, if someone is still having a fall and the 10-year span is there, then they must be vaccinated again. So these are the few practical implications of today's topic. Thank you very much once again.
Thank you, madam. I will definitely add those slides.
Ma'am, thank you.